All right, everyone. I found this morning that if I start pacing the room a little bit, people kind of stop their conversations. We're going to go ahead and get started. For those of you joining us by Zoom, we have a couple. We're happy that you're here. I know everybody probably gets sick of listening to me with these housekeeping tips around Zoom, but if you can just make sure you're muted on your end. Star 6 to mute and unmute if you're only on a phone. Emma will be monitoring Zoom, so if you want to chat in comments, raise your hand virtually, or just jump into the room, please feel free. We'll try to make it as easy as we can to accommodate those of you that are joining on Zoom. And with that, I'll give it to Shannon and John. You guys have a shared mic just to say hi, welcome people here, and we can do some quick introductions. I think this is meeting number 3. I'm losing track. We've had a lot of subcommittee meetings, and last week I got fully into a room for a subcommittee and had the wrong name tags at the door. I realized it before that people started coming in, but we've been fast and furious. So number 3, we're starting getting to know each other, but I always think it's nice to go around and just do a quick introduction so that we can reacquaint, and then we can dive into what we're gonna work on today. So I will pass this microphone. These are pretty good at picking up sound if you project, but using the mic is always gonna help, and it's actually pretty helpful for those just even in the room to use the mic. So I'll try to run the mic. Shayla and I will be doing that today. Do you want to start? Just name and who you are.
Leslie Patterson. I'm volunteering on the committee. I've worked in child advocacy for a couple decades and interested in how we're moving forward.
I'm Brooke Greasy. I'm co-founder of Judy's House and Jag Institute, which is a comprehensive center for grieving children and families, and a clinical psychologist.
Hi everybody, I'm Kendra Kleinschmidt with Eagle County Department of Human Services.
Hi, I'm Lenny Robinson. I'm a psychotherapist and I am the Chief Operating Officer at Jefferson Center for Mental Health.
Hi, I'm Morgan Bruss. I'm a school psychologist with Harrison School District 2 in Colorado Springs.
Representative Mary Young, standing in and subbing for Representative Michelson-Dene again. My background is a school psychologist and a special education teacher.
Hi, I'm Jennifer Brody. I'm a clinical psychologist and director of integrated behavioral health services for Denver Health.
I'm Rebecca Hay. I'm a clinical psychologist and the executive director of Denver Children's Home.
Thanks, Camille.
Camille Harding, I'm a division director for community behavioral health with the Office of Behavioral Health.
I am Primavera Lieutenant Governor.
Hi, Sarah Davidon with Mental Health Colorado.
Rebecca Swanson, representing the Office of the Child Protection Ombudsman.
School psychologist and director of special education for Fountain Fort Carson School District.
John Malkinen, the ACC Pediatric Behavioral Health Liaison, working at the Department of Healthcare Policy and Finance. And we definitely want to thank Lieutenant Governor Primavera for being here today.
Shannon Van Diemen, Children's Hospital of Colorado, and also Partnership for Children's Mental Health.
Shayla Long, Farley Health Policy Center.
Adrienne Maddox, Stanford Indian Health and Family Services. I'm the executive director.
And then we have a couple of people who have joined from Zoom. I'll pass to Emma.
So we'll just we'll say your name, let you say a quick hello, and just remember to unmute yourself when you do that. So Dr. Fraley.
Hey, this is Cecile Fraley, Southwestern Durango. Thanks.
Dr. Wells.
Hi, I'm Catherine Wells. I'm a child abuse pediatrician and the executive director of the Kemp Center for the Prevention and Treatment of Child Abuse and Neglect.
Shannon Seacrest.
Hi, my name is Shannon Seacrest, and I am actually a parent of a 16-year-old with 12 different diagnoses, which includes behavioral and mental health.
Lindsay Reeves. Lindsay's going to be joining us by chat, and she's with the early childhood programs at Catholic Charities in Pueblo. Are there any other members of the children's subcommittee on the Zoom line?
All right, and I'm sorry that I didn't start with Shannon. I got carried away with my housekeeping. Is there anything else you wanted to do to
hello? Is this on? I don't think this is. This one's being temperamental.
Thank you.
So I just wanted to thank everyone for coming again today. We did have a behavioral health task force meeting this morning, and I think John and I felt pretty good after giving an update to the behavioral health task force about the things that we are working on and the things we're getting ready to address. Seems to be aligned with some of the direction that they're wanting us to go. And so I think that was validating that we're talking about the right things and working on the right things. And so today we want to spend some time just briefly revisiting the value conversation and then really diving a lot more into the governance discussion that we're having. And then also just wanted to make you aware that we are working really hard to develop a high-level roadmap so that directionally we can kind of see when various topics are coming up. So when are we going to be talking about financing? When are we going to be talking about access? When are we going to be talking about, so that we can make sure that we address all the topics that we think we need to be addressing and that we use our calendar and our time well to do that. And so hopefully by the end of this month, we'll be able to share that with you so you can kind of see direction where we're going. John, did you have?
All right. Welcome, everybody. We are ready to get moving for the day, and thank you all for being here again. The objectives for today, the main work that we're going to be focusing on is first taking a look back at the survey. We thank you all for responding to the survey that we did following the last meeting. We spent quite a bit of time, as you remember, talking about a value statement, talking about the values that are unique to children's behavioral health that we want to be sure are included in the overall blueprint, and that message comes through. So we'll review that briefly, and then we will review the findings from the survey around the goals as they relate to a couple of goals as they relate to governance and systems management. And I think that's really going to lead us into, there was some good feedback from all of you who responded that will lead us into a conversation today to go deeper into the governance and systems management structure. Okay. Next slide.
I'm going to give you yours. You can drive.
Thanks. So to just formalize the work that we've done and to make sure that we can put this into public record, I'm hoping that everyone had an opportunity to review the minutes from our last session. And if there's discussion around those minutes, yes, Morgan.
On page 4, my name was listed as Megan Bruss.
Thank you. We will change that. Any other comments, discussion of changes that we should apply to the minutes?
I know there's one that I also received Rebecca Swanson. We had listed as saying something for Rebecca Hay or vice versa. So we'll make that switch. We'll get the right Rebecca.
Okay, good. We don't want to confuse Rebecca's and get comments attributed to the right folks. Anything else that needs to be modified? Yes.
So I just had a question, and maybe it's right. So it's on page 2, middle of the page, it says vigorous discussion was had resulting in the following themes and comments. And it doesn't look like the comments and modifications from the papers up on the wall are included in here.
Those are the comments here.
Because I thought we changed member-centered.
So
because we're not talking about members.
I think how this is reflected, it's hard since that was kind of a working conversation and things were crossed out, but thank you. So member-centered was the word on the page to start, and then A is replace member with child and youth. So they kind of added comments underneath to reflect suggested changes.
Okay, so this doesn't have the changes. This is still just the suggested changes.
This was what we ended with as far as all the comments that were added and or taken away on the wall. So just from that conversation, is that clear? And then the product that we emailed out, that's what we'll look at today as far as reviewing that piece. That has the final changes, if that's helpful.
I didn't know if we document anywhere like the parking lot issues so that we don't lose sight of what those are.
That's a good point. I've not seen the parking lot issues in the minutes because they're kind of in the parking lot, but they're absolutely being collected and maintained. But it's a really good point, and we should figure out the best way that we can document all of those parking lot comments so that they can be seen. Thank you.
I just wanted to add, we'll circle back with Summer. I'm not sure that those will end up in the minutes,
right.
But we can make sure that there's ways that you know that we're following up on them.
Yeah, I think that's, I meant to say it that way, that, you know, they aren't generally officially part of the minutes because that was really what the public open discussion was about, but we don't want to lose them. Yeah. And we haven't, they're all captured. So there should be a way that you can reflect upon those and make sure that they were captured accurately. Any other edits or suggestions or modifications to the minutes? If not, maybe have a motion to approve. Second. All those who approve the minutes, say aye. Aye. Any nays? Any abstentions? Thanks very much. We will enter those into record. Keep things moving. All right.
We also have Lindsay Myers on the phone. She has joined in from Atlanta.
Wow. Hi, Lindsay. Thank you for joining us.
I'm happy to do this for you if you want me to. I don't mind. I just feel like if Portiel saw this slide probably 5 minutes ago, and I agreed.
No, actually, this is the first time I've seen it.
Okay, so I'm happy to do it. Yeah, I'm kind of a calendar freak. Like, I love calendars. My family hates that I love calendars. So this was my pleasure to put into a slide. So I just wanted, what we were trying to do here was try to get each subcommittee looking a little bit further out than just meeting to meeting. And you can see we got in our strategic conversations with the co-chairs in summer, kind of got through the end of October, trying to figure out where we pivot the work in November. But we just really wanted you to be able to see that we're moving in a planned direction to try to get through aligning some of the mandates that we've received from the governor's office in terms of what the subcommittee needs to accomplish, things that have come out of legislation that's leading the work, and then just things we're hearing from you in terms of priorities for accomplishment in this group. And so we're working on that, and I'm sure by the next time we're together, we'll be able to tell you what to expect through the end of the calendar year. But you can see that today we're gonna really focus back in on this value statement work that you all have really put a lot of thought into. I know it's not easy to come back to this kind of level setting conversation again, but I can tell you from experience with the Farley Center and with other groups in other states we've done this with who've skipped this process, we've really regretted it. It deserves the time to get it right so that everybody can constantly come back to these values and principles as the North Star for the work. When we start to inevitably go down a different path, we can pull you back into what we actually decided we were really gonna focus on in the beginning. So it's painful, but it's time well spent down the road. And we'll move into finalizing work across the governance structure as Shannon described through the end of this month, and then move into some of the other elements of access screening assessment and thinking about an array of services. And all along that, trying to identify best practices in other states that we can build in, we can try to scale, we can try to see if they fit with the work in Colorado, keeping an eye on how legislation is guiding this work, considering state agency alignment, which is something that really came back strongly in the survey that we really need to be cognizant of. And John and Shannon did a really nice job. I will call out to them in the task force meeting this morning. I'm really kind of trying to scale what the children's subcommittee is focusing on. So that's a good place to be gauging state agency alignment because of the executive committee and those that are represented there. So we also just wanted to put up, because of the holiday schedule, we're going to do a little tweaking in November, December. There was a children's subcommittee meeting scheduled for Thanksgiving Day, and we figured no one would want to be here. So we're going to extend the times in the early part of the month and then eliminate a second meeting. So those updates I think came from Youngshin earlier this week. You should see them on your calendars, but just so that you know as a reminder that they're coming. All right, any questions about timeline, calendar? No? Okay.
Thanks, Stephanie. Yeah, I think the only thing that I would add is that just that sort of, again, North Star reminder that ultimately we're aiming toward developing a set of recommendations that will inform the children's focus as part of the blueprint. And we're really going to be digging into those as we get into the end of the year. A lot of this that we're doing right now is sort of establishing the governance is a huge idea to be able to wrap our heads around, and we're going to focus on that for the rest of the month as we need to for this meeting and the next. But really thinking toward how that will define recommendations and building those out and honing in and specifying them. That's really the overall purpose. Okay. Any questions or thoughts on that before we keep moving?
Just a quick note for those of us who are eyeball challenged in the back. We can't read that at all. Right. So any explanation of these would be great.
Right. So I appreciate Stephanie's articulating all of what is actually in there. Even for me, not in the back, I was like, oh, Stephanie, why don't you help me out with that one? Yeah. So thanks. Okay. So, like all of our meetings, the public forums, we welcome folks who are not on the subcommittee to join us for each and every one of these meetings, and we are grateful for the fact that you would take the time to come and join us for today. We like to have some time right here at this sort of opening to allow you to share with us questions or specific issues, something potentially that may have brought you in today that compelled you to join. And so I turn to our friends from the public, which I'm looking at that side of the room.
You want me to pass the mic back there?
Yeah, that'd be great.
We're unfortunately down to one microphone. The lavalier has been not cooperative all day. So, anyone?
I'm not shy. Good afternoon. I'm Rick Padilla. I spoke last time. I just wanted to thank all of you. I testified at the Behavioral Health Task Force meeting the other day. I really appreciate the effort you're putting into to get public input around this very critical issue in terms of access to care for our kids. So thank you.
Hi, I'm Aubrey Boggs. I'm the new Ombudsman for Behavioral Health Access to Care. I'm also a person living with mental health conditions, and this group in particular is very important to me because the first time I was suicidal was when I was 11 years old. And I know how important it is to make sure that youth are getting access to the care and support that they need. So thank you all for your work. I'm also on the Safety Net Subcommittee, I should mention.
Hi there, my name is Lauren Carvey. I'm the Legislative Liaison at Denver Human Services. So I'm just very interested to hear your conversation and understand how that will impact our child welfare world and making sure we can get services to all the youth and children in need.
Hi everyone, I'm Elizabeth Freudenthal. I'm the new Mental Health Senior Policy Coordinator for Children's Hospital Colorado. Happy to be here, thanks.
Hi, I'm Margie Grimsley with the Colorado Federation of Families for Children's Mental Health, and this is my world. I'm a parent and a consumer, and also this is the work that we do at the Federation. So everything that is done here has been part of what we're doing, and our goal is to really be able to help families in the best way possible. So we appreciate what you're doing, but we also know that there's a lot of work to be done, and our role is to encourage families to be able to share their stories so you really do understand the needs of families from across the state. And just to add that I am the most passionate person in the world regarding system of care. It's been something that the Federation has focused on since the beginning of system of care. And I really, truly believe if we look at that as the model, there's not much in it that doesn't really give direction on how to go and how to help families and their children in the best way possible.
Hello, my name's Margaret Ilmer. I'm with NAMI Colorado, and likewise, this is very close to the mission of NAMI Colorado. So we are very grateful that this work is getting done.
Hi, I'm Andrew Gabor from the Office of Behavioral Health. I'm no stranger to you all. So thank you again for day number 3. I'm very excited. Thank you.
All right, Sheila, I'm going to move it over there.
Yep, we're good. So thank you all.
Just make sure
Yep.
that
Yeah. I said this morning next time.
You can't hide anywhere.
Hi, everyone. Good afternoon. My name is Chelsea Hall. I am a 2nd-generation manager at the Colorado Department of Human Services. Just like to say that we are all here and very passionate about children, but let's not forget the caregivers in their lives as well. Thank you.
Hi, my name is Hannah Ayers. I am an intern at Mental Health Colorado. Happy to work at Davidon, and I can say as an intern, being in these rooms is the most educational experience I can have in college. So thanks for the opportunity.
Hi, my name is Laura Clevenger. I'm also an intern at Mental Health Colorado. Thank you for this opportunity as well.
All right. All right. Well, we welcome you again. Thank you very much for being here. It's challenging when these subcommittees get put together because there were so many, just as a reminder, so many people who volunteered and were nominated to be part of the subcommittee. And so being able to bring in voices from outside of the subcommittee is critically important. And this is just one opportunity to do that, in addition to the other community meetings that are happening and so forth. And do we have anyone else on the phone?
No other comment though.
Very good. Okay.
But we do have quite a few folks joining, 27 participants. So from members and then members of the public.
All right. Okay, you ready to dig in? Let's go. Okay, like you said, to try to keep the work moving between these sort of every couple weeks or once a month meetings, we're really trying to follow up on the conversations that have been had. And this is just to share back with you what we learned from you all following the last meeting. So we worked on a vision statement, and we, as you will recall, put together all of these ideas of what are the critical values to children that were put up around the room. And after really scrutinizing that for some time, we realized that a lot of that is actually captured in the primary vision statement for the overall Behavioral Health Task Force. And so that's what you see up here. Of the 17 respondents, we had 17 respondents overall, and this is the vision statement. This was the question.
And there's a typo, sorry.
Yeah. Yeah, so the vision statement, we have a place where we can read the vision statement.
It's on the next slide.
Okay. So we had 88% who fully support the vision statement as written of the respondents. There are a couple of tweaks to be considered, and we can talk about those in just a moment. And there really wasn't anyone who felt that this needed to be significantly modified. So the vision statement, a comprehensive, equitable, effective continuum of behavioral health services that meets the needs of all Coloradans in the right place, at the right time, to achieve whole person health and well-being. Once we really looked at the values as we articulated them for children, it seemed that there was a lot that's captured here, and that if we're really including children in this, much of what we thought of around values were actually captured in that, provided that we focused on a value statement that was unique to children, that reads as such: a system that supports child and youth-centered care, incorporates the vision and principles important for all Coloradans. Additionally, it recognizes the unique necessities of developmentally appropriate care, engaging and strengthening families, and creating supports. Not every word that was on all of those sheets we put a lot in, we tried to see what would fit, but in sending that all back to you, that's where we had an 88% agreement on this. Yes.
I think it's not represented here, but there was the list of principles or priorities, I think was the principles that were listed underneath, and we did try to incorporate as much of the feedback as well into those sub categories underneath the larger vision statement. And so again, it may not be here, but I think we were able to get the majority of the importance and passion that we reflected in those principal statements as well. So I just want to highlight that.
The one issue, there are a couple of tweaks that we said were called out from the 12%. The two people who said, maybe there are a couple of things that need to be different. One thing that I think is important to recognize is there was a concern that perhaps we had narrowed our focus to mental health and not behavioral health overall. And I want to reaffirm that that's not the case. We're really talking about behavioral health, so mental health and substance use combined. And that is the vision for the overall task force. That should be our vision as well when we're thinking about children. Okay. And the other comment?
The other one was related to end of care being associated with wellness being achieved as opposed to number of sessions or days of treatment.
Yeah, that we're really seeking toward achieving optimal wellness, not aiming toward defining a specific number of services, a specific number of visits that constitutes service. So before, I guess, jumping into the goals that had a little bit more concern and or ideas that were brought forward, is there anything further that people want to discuss as it relates to this value statement? Our intent is that if we've got 88% fully supporting, and that we recognized the two comments that we're hoping to have that revision to understand well-being, wellness, and behavioral health as opposed to strictly mental health. Is there anything else further, or can we adopt this and feel like we're all good with this value statement and vision? Yes.
Here, Michelle, I'll take the mic back to her. If people project, these are mics in the middle. I know it, but they really need.
My name is Carol Meredith, and I can project pretty loud. I'm with the ARC of Raphael and Douglas, and I'm sorry I'm late, but I-25 was what it was. So the only thing I see missing in both of these statements, which I think you allude to when you get to the wellness thing, but it's kind of right time, but we don't say the right amount of services. And for people with IDD, that's what we see all the time, is that, in the regular mental health system, you're going to get 16 visits for depression because that's what it takes to do depression. And if you have a cognitive impairment, it may take 32 visits. And so it's a critical issue for me and the constituency I represent.
Any comments? I think it's important, and I think that like I said, we're trying not to allow ourselves to get boxed into limiting the number of services and as it relates to amount, which is partly, I understand what feels.
I just think of, and I definitely appreciate and welcome any criticism or critique. Wide vision statement, I come back to the idea of effective, right? And if we can say, as we move forward in our decisions, that effective has to be determined by the functioning, well-being, stabilization of the patient, regardless of what the 6 short-term behavioral health, 16 depression, if that's not our rule, if we're not gonna, if we can create a system that isn't just rigidly confined to what other standards are, but we're gonna value effective. And I think it's the top 3 words: comprehensive, equitable, and effective. And so again, that's a high level sense that I think maybe we all need to continually be reminded that even in the ongoing conversations, recommendations regarding, limits on number of sessions, et cetera, should be addressed and called out in the practical implementation of this system. But as a value system, I appreciate hearing what you've just shared. And I'm hoping that we can actually say, if we have a continuum of services that's not effective, then we haven't done our job, right? And so for whatever the population or specific needs are. So I appreciate that.
Yep. Yes. I don't know if you want to shout.
I was a cheerleader once.
Not for a while. No cartwheels. Well, this morning we had a discussion. We had the large behavioral health task force, and one of the safety net people suggested that the word system was something they wrestled with. So, what is a system? Was one of the questions from this morning. The other thing that, as I look around the room, we're not very culturally diverse, and I know making sure, since I work with the tribes, the Colorado Commission of Indian Affairs is in my office. The big concern with the tribes is that people they provide culturally relevant services. So I don't see anything here about things being culturally relevant, but I think that's really important depending on which group we're working with. So just a thought.
Yeah, I appreciate that, and I do think, as John mentioned, some of that language has been drawn into the principles. That if we were seeing, which we just didn't load all onto the slide, if we were seeing the vision statement with all of the principles that have been articulated for the task force, and then the value statement, I do believe that that language comes in actually quite well. But I'm conscious also of your first point around the word system. And we use that word a lot as we're talking about what we're trying to put together here. It isn't in here, so I think the conversation must have been around, does it need to be in here? Yeah, we talk about the adult system.
Cheryl and John and Shannon, we can share a screen and pull up the principles that would be helpful.
Do you want a reminder of those specific principles at this time? Or is that something that we can share back with you just so that everybody can confirm that their language is?
I think it'd be helpful since it was raised, and since it was not at the meeting last time. I think it's a really important point to demonstrate that it is covered. It would be helpful to see the principles.
Okay. You guys, you work on it. Well, yes.
Just a clarifying question. Is the vision statement representative of the larger behavioral health task force? And then this group has the value statement?
Yes.
Okay, so I'd like a little clarification on that first sentence within the value statement. We're kind of referencing the larger vision statement. Is that how I'm understanding it?
Yes.
Okay.
Yeah. Yeah. We anticipate that everything that comes from this subcommittee will be fed into the overarching blueprint. It's not an independent set of a report that is going to sort of live as a standalone from this work. And so it all feeds into the ultimate blueprint that's being developed and the vision that is guiding the task force overall, and thus should guide each of us in the subcommittees, is how that vision statement is crafted.
Okay.
Is that fair?
It is. I understand now. And to Diane's point, I think the word culture should be reflected in the value statement, not just in the principles, would be my 2 cents.
Thank you. Okay. So at this point, we have the principles listed under each of those 3 sort of categorical areas of effective, equitable.
Sorry.
Yeah, we're not at the top. It says equitable and effective. And I don't know that some folks can read them. Can you read them from the back? Shall I read them? Okay. As I read them out loud. Okay. Under comprehensive principles, we have individual and family-centered, respecting the agency of the child and family in solutions and services, addresses social determinants of health, coordinates for normalization across systems and sectors, social services, parenthetically, housing, employment, food, etc., public health, healthcare, education, criminal justice systems. Those are our systems and sectors. Provides a continuum of care that recognizes wellness across the spectrum of promotion, prevention, treatment, and recovery. Provides a continuum of services across the lifespan. Increases the number, type, diversity, and investment in behavioral health professionals across the state. Integrates physical and behavioral health services for no wrong door access. Pause there for a moment. Equitable is qualified as equitable and unobstructed access to behavioral health services, regardless of zip code, payer, source, culture, etc. Easy access to culturally and linguistically responsive services. Easy access to trauma-informed care. Statewide safety net system that provides services to all individuals regardless of complexity. And under effective, we have a statewide system tailored for locally driven, community-based, timely solutions, accountable and sustainable allocation of financial resources, quality assurance processes to support provision of evidence-based services and monitor service outcomes, data-driven, continuous quality improvement and evaluation at population and individual levels, and prevents worsening systems or involvement in the criminal or juvenile justice system.
I can't help myself but to remind the group of the last time we were together and what we kind of decided about breaking out the principles versus the value statement, and that we were really, really striving to eliminate redundancy, that the value statement needs to be something that sort of stands alone while these principles speak to what we mean by that value statement or by that vision statement. And so I think it's important that we revisit it. But I also want to remind that we got 88% behind it. I guess what I'm trying to say is, I don't know, something my dad would say about like enemy of good is okay or something. Like if it's good enough, we should probably get to a point today where we can say that and then move on so that we're not feeling super stuck. Thank you. Yeah.
I just want to clarify too, at the discussion last time, there were two comments that were made that I think we tried to consider. One was when we looked at the main behavioral task force vision, it seemed like a lot of what we were saying was already presented here. And the other thing was on the opposite end of the spectrum is, are we just saying a whole bunch of things that aren't really kid specific? You know, and I don't know if you remember that conversation. And so that's why we said, all right, well, let's go back to the original behavioral health vision and principles, and then address our kid-specific components. And so it was kind of an integrating of all of that feedback as far as the best approach and looking at it in this way. And you probably can't see it here on this screen, but there are words that have been changed in these principles, you know, that mention feedback regarding bureaucracy. And so the idea of unobstructed or easy access, we've added that. We've added the words in investment in our behavioral health providers. So where it was increased number, type, and diversity, we added an investment so that we're talking about payment and, you know, retention, et cetera. So we tried to truly infuse the feedback we got with the main task force behavioral health statement and principles, as well as honor our child and youth components. So that's kind of how this product ended up.
Sorry, this morning I was talking to I always, having worked in the field of disability all my life, look for the word disability. And I know in one of these parentheses it said etc. But I think it's really important what's in that etc. I think we need to maybe spell out some of the groups that really have been underserved by our mental health system, and you know, maybe sexual orientation or that kind of thing, because transgender youth have a really difficult time. And there aren't a lot of providers that understand that. So I think that et cetera is nice, but I just think some of the other groups that really have a difficult time with the mental health system should be spelled out.
Any other comments before we move into a little more of the survey results?
Okay, well, and I can also bring up parking lot. Vanna.
Yes.
So if there are additional things that you really feel like need to be up there, if there's a word, if there's something that you really feel is missing, this is a good place to.
The next component that we'll get into is really just, fortunately, we really just had 3 questions, right? We looked at the vision and value statements, and we looked at governance, and we looked at systems management in terms of getting some feedback from you all on the survey. And overall, from those who responded, there was really a lot of support. 88% for the value statement, like we said, and then, oops, sorry. There we go. Now we're good. And as it relates to the goal of establishing a centralized governing body, recognize that this is a goal that has come from a great deal of work that led to the development of goals, not a goal that we were adopting as much as how do you support this goal and how much we would then dig into clarifying and defining recommendations that would continue this work. So if the goal were establish a centralized governing body with authority, clarity, capacity, and credibility to govern the Colorado children's behavioral health system, we had 59% support. We had 29% that thought there were revisions to be made, and there was 12% that did not support this, this concept. So more than a majority that do support, and those who wanted revisions suggested that we should have caution to not create further fragmentation or layering of governments without reasonable accountability. And in tandem with or comprised of key stakeholders, including youth and individuals who experience behavioral health system as clients. These are critical components that we need to be considering as it relates to governance. And I think really leads us into the depth of the conversation that we want to have here as we talk about what does a governing body look like. So I see these revisionary comments as leading directly into the conversation that we want to have today. I think there is going to be more that we're going to generate from that, but overall we have support with that kind of lens on a governance body. The reasons for not supporting are an effective whole system is needed, not a carved out children's system. If one was perceiving that having a governance structure for children's is a carve out. I don't think it has to be, but I think that that is what the concern is around that response. And one body should not hold all the responsibility. The system is too complex and requires oversight across different private and government agencies. So those are important concerns, and I'm turning to Shannon on this a little bit. I think my inclination today would be to share with you these survey results and discuss this as we move into the discussion on governance. Are you good with that?
Yes. I mean, I think it makes sense because a lot of this can be addressed in how we choose to design the governance system. And so I think that it doesn't have to be one body, it can be multiple agencies that are coming together. So I think that we can address these and thinking about how we're potentially proposing a governance structure and how that would be effective.
Really what I would say is that this information has helped to shape the conversation that we want to have today, not that you were voting on yes or no on a governance system, because we haven't yet decided what that governance might look like. Is that fair? Okay, so that's some of the important feedback that we got around what a governance, how we need to begin to think about governance.
Can I just ask for further clarification? And my apologies, I was out of town at the last meeting. For the goals, how did we get the goals?
So these were taken from the 4-year strategic plan that was recently created for children's behavioral health. So that was one of the foundational documents that we read and we actually reviewed in our first meeting. So there were 36 working sessions with like 250 stakeholders engaged, and that process was just completed like last October. I think the other thing I'll say is
Was that the Children's Hospital project?
Partners for Children's Mental Health. And it was done in collaboration with OBH. We had co-chairs from BHIF, so many folks were engaged in that process. Aside from that, when you read the literature as it relates to designing children's behavioral health systems, these are two of the foundational issues that they say you need to address when it comes to designing an effective children's behavioral health system. And so we're relying on that literature as well. So one, these were the goals and recommendations from that report. But in addition to that, there's like solid research in many other states that are doing these types of models that would suggest this is worth us having a conversation about. And we're going to reintroduce like what we mean by governance, what we mean by systems management. And so it's hard in terms of the staging, providing the survey feedback because we got it while also wanting to be foundational about what we're talking about when we use these terms, governance and systems management.
But that's where the language came from, or the way that this goal was written. It's not, again, something that we have developed or are putting forward as a goal that's coming from this subcommittee, as much as to set forward the concept that we could then refine. If we believe and we have 76% support, that yeah, it makes a whole lot of sense for us to be thinking about our systems management. That's a goal that we should, that we value. And yes, let's dig into it further because we don't think that this, as it's specifically written, necessarily reflects all of the kinds of recommendations that we would want to make coming from this subcommittee. Is that fair? Did I see another hand?
Susanna Snyder actually co-chaired this group.
Okay. Yes.
We talked about it a lot.
This is Camille. Just quickly, I don't remember from the PCMH literature that we had to review before we started the subcommittee if it made reference to the literature that supports the governance structure, if that's in that, it's referenced in it, or if we could just redistribute it if it's separate.
The readings that were sent out to read about governance and system management are that.
Okay, perfect.
Okay. Any other thoughts? So as we looked at a goal for systems management, this was articulated as identify, formalize, and fund a systems management entity, which will serve as the locus of management accountability for our target populations within Colorado's children's behavioral health system. That conceptually had 76% support from those who responded. One who felt there should be revisions there to explore additional options for governance beyond current state and frameworks that extend beyond highest need youth. So I read that as being more inclusive in our frameworks, that we ensure that we really adhere to our overall vision statement, right? That this is really for all Coloradans and not just for and children included, but not just highest need youth. And then there were 3 responses to not support, or 18%, stating that depends on what the governance body looks like, right? We don't know how the systems management will play out until we know what the governing body is. We need to stop doing things for constituent populations and do this with key constituencies. And a systems management entity is another term for an administrative services organization, which is another layer between child, family, and their provider. And that is a concern that was brought forward in our meeting the last time, that, you know, we don't want to be creating additional bureaucracy, making it harder to actually get to the services. And so that's reflected here, I think. Again, I think these are all really important comments and feedback that we can take into consideration as we develop recommendations on whether or not we want to have systems, you know, how we want to address systems management. But certainly 76% of those who responded said, yeah, we've got to at least think about it and make sure that we're teeing up our recommendations. So with that, I think it's best to move into today's discussion, which will revisit the distinction between governance and systems management based on the readings that you all had an opportunity to review in advance, and lead us into questions to really dig in deeper on how we address these concerns and really reflect the expertise and the input of all of you around the table.
Okay. All right. Thanks, Jim. So it was interesting. The Behavioral Health Task Force was today, and it really led into this conversation, I think, really well. So one of the things that were sent out was this legislative overview. And I know that we all got it too. And when you look on page 2 of that, there was a table at the top that's talking about like who has authority for governing the behavioral health system that exists in Colorado. And so we talked about Colorado Department of Human Services, Child Welfare, the Office of Behavioral Health, the Colorado Department of Public Health and Environment, the Healthcare Policy and Financing, kind of what each of the programs are that are working.
Just to let you know, we actually not distributed.
Oh, I asked them if it was sent out.
It was part of the survey. And so there were questions that we linked to it in the survey, and then if you had additional questions.
So, all right, well, if you don't have it, we'll give it to you.
It was, yeah, it was in the survey, so we'll send it out again.
Yeah, so we'll send it out again. So the only reason I bring this up is one of the things they were talking about in the task force is the complexity of the behavioral health system, that we have all of these agencies. And in this table, they only highlighted CDHS, CDPHE, and HICPUF, but then they also noted the Department of Education, Department of Corrections, the Governor's Office, Department of Public Safety, Attorney General's Office, Division of Housing, Division of Vocational Rehab. They talked about plus local counties and municipalities. And so, like everyone's responsible for governing behavioral health, and consequently, there are a lot of families that are falling between the cracks, between agencies, span of responsibility and scope. And so they talked about the importance of reducing duplication, and they also talked about improving integration. And so it was interesting that that was the conversation, one of the conversations that was happening at the Behavioral Health Task Force, and really leads us into the conversation we're having today around what is the idea of having a governance structure. And these are the types of problems that you're trying to address. So we do have a lot of state agencies that have mandates to do things, but how do we make sure that they're working together and that families aren't the ones caught in the middle of trying to gain access to services and understand who's responsible for funding that, paying that, solving those problems. So we will get that out to you, not only for the legislative review and in preparation for our conversations around legislation in the next couple sessions, but also so that you can look at that because it's pretty interesting as well. So just to remind everyone, I want to review 2 of the slides that we have reviewed last time, since not everybody was here and since the bulk of our conversation is going to be around governance, to make sure that we're all on the same page. So when the 4-year strategic plan was put together, one of the main things that was done is a review of previous reports and recommendations that had existed. And so there were 8 different reports that had existed and been done as it relates to children's behavioral health before we even did the strategic planning process that recommended that there needs to be some type of a governance structure as it relates to children's behavioral health. They talk about the fact that we need a centralized and statewide governing body. We need to formalize linkages across all these state agencies that we were just talking about, and work on regional and local entities as well to streamline administrative, fiscal, and management functions. We have a lot of duplication of efforts that we think can be eliminated, and more funds can be used to support families and youth, which is what we're needing to do rather than these multiple administrative structures. Reducing duplication and redundancy, address widespread problem of fragmentation and siloed systems that oftentimes our youth and families are getting stuck in between those systems, or if they're in one system and they no longer are eligible, then they lose access to services. So how do we make sure that they're not dropping off as they drop out of systems? Collaboration and joint accountability. So again, if everyone is responsible for children's behavioral health, no one is responsible. So where do we go to solve these cross-system issues and to address the needs of all kids? So that was the foundational work that led to the recommendation that you all had on the survey as to whether or not this is something that's needed. It seems like there's a lot of consensus that this is needed and would be helpful. When looking at the literature around key issues that we need to address when doing governing entities and to make sure they're effective. So John was doing some research around when these aren't effective. And
making sure we address all these issues when designing a governance structure is how we make sure that we set it up to be effective. So one of those is has the authority to govern. So in places where they've tried to set these up as like an advisory council, but they have no real authority, they have no fiscal authority, they're just putting recommendations forward, those are not effective. Those types of like commissions and advisory boards where there's nowhere for it to go and they can't actually change things isn't helpful. So we need to make sure if we want to set one of these up, that we're setting it up in such a way that it's going to have authority to actually govern. And so that can be done through a lot of different mechanisms, legislation, executive order, memorandums of understanding, through regulation, etc. We need to be clear about what our governing body would govern. So what are our populations of focus? So that comment a moment ago about making sure it's not just high needs kids. So we're like, okay, then what do we want under the umbrella of this governing body as it relates to children's behavioral health? In addition to populations, you can talk about functions. And so when it comes to things like a mobile crisis response system, like that's something that we just need statewide. That doesn't necessarily have to be every entity trying to figure out how are we going to respond to crises. Maybe we say crisis should be a system-wide function. Screening and assessment and entry should be a system-wide function, so that people have a place that they can go and you don't have to navigate each system differently. So we need to identify what types of functions we would want included under this governance structure. It needs to be representative. So again, this is one of the comments that was in the survey that I think we can address in terms of membership, rather than doing, I think it was saying 2 patients and family, or family and youth, having them engaged in the process or making sure that what for do with them, not for them. And so I think this is an opportunity for us to make sure that when we're talking about membership, that we have families and youth engaged as representatives on our whatever governance structure we might want to set up. Has the capacity. So this has to deal with staffing. Setting these structures up without adequate support to do so is not effective. So this is again learning from other places. Has credibility and assumes shared liability across systems for target populations. So we need to make sure for like state agencies that are engaged in this, that there's some amount of accountability and shared liability across. So that's the governance piece. So to distinguish that from system management, so governance is more about decision making, policy oversight, probably funding types of decisions. But then the question becomes, who is the management implementation arm? How does that actually go about getting executed? And so we have a lot of examples in other states, like Maryland has a children's cabinet, but then they set up the governor's office for children, who is the one that actually, if they have the funds that they've brought together, they're issuing the RFPs out to make sure that services are being done, to make sure that vendors are being identified for the crisis system, etc. And so the idea of governance is you have decision makers, and then system management is you really need to have implementers or doers that are then executing on that vision. So you want to create a locus of management implementation accountability for the target populations and functions that we decide that we want to focus on. Shared governance within systems management spread across many systems is unlikely to produce an integrated delivery system. So if we have, again, a whole bunch of people responsible for systems management, it's probably not going to be effective. It's not going to feel integrated. So how do we make sure that we have a locus of accountability for that? There are several different structures that have existed in a lot of other states. Some use a lead state or local agency. So in New Jersey, for example, they created a new state agency, and they just said anything as it relates to children's behavioral health is going to be done under this state agency, period, the end. This is the ones that are doing it. So that was no longer distributed across agencies. They pulled together resources, have saved hundreds of millions of dollars by doing that type of model over the last 10 to 15 years. Some states do interagency bodies or advisory councils. You can do tribal agencies, quasi-governmental entities, or as someone mentioned, like an ASO type of structure. There are some places where they do it through like a managed care type of approach, but you don't have to do that. So those are all options of what we can consider when we're looking at this. So the key issues when you're designing or looking at good system management entities, or the things you really need to think about, is we need to be sure that we make the reporting relationship clear with the governance structure. So how is it that the system management is going to relate to the governance structure? What's the reporting relationship look like? We have to have absolute clarity on the expectation and outcomes that are to be achieved by that system management entity. Again, sufficient technical and staffing capacity, and that they have credibility. So pretty much all of the things that we just went over, we have as potential and necessary discussion topics. So all the things we said you need to think about when designing the governance structure, all of the things that we need to think about when designing system management structure, we can go through and have discussions about that. I want to call your attention to a few of the handouts that were given to you today. So we didn't necessarily want to start with a blank slate. This graphic right here, there was a stakeholder process that was actually done around this time last year in the state of Colorado to say, like, what would we want to set up in Colorado around this. So that generic recommendation came out of that 4-year strategic planning process. And then this was taken and a group of stakeholders went through and kind of designed what they thought would be a good approach for Colorado. I'm not saying that this is, I'm just saying this is work that's been done that we can look at and determine how we feel about that. One of the things that's articulated here are scopes of work to be addressed kind of by the governance and system management function, which obviously we can ignore that. We're going to be designing what we think our scopes of work should be for this, but I just wanted to give you this as a starting point so that we don't have to completely start from nothing and we can start reacting to what's in front of us. So this contemplates an Office of Children, Youth, Health and Policy Coordination in the governor's office, and then a commission. I think people didn't like the word cabinet, so I think they went away from cabinet, went to commission with this type of membership. And then the idea of an advisory council that would be feeding into that commission. And then the idea of executive work groups to work on specific scopes of work. So the management function in this a little bit is that office in the governor's office. Then you have the commission and advisory council that are doing a lot of the policy making, decision making, and oversight from that perspective. We also gave you this children's mental health governance handout. There are some examples from some other states like Florida, Texas, Illinois, Kansas, Louisiana, Maryland, so that you can have that to kind of look at how have some other states done this. I know John has a list over here of like how many states have children's cabinets, of which there's a lot. So we wanted to provide you with some information so we're not necessarily starting from zero, and we can look at how some other states have addressed these challenges. So hopefully you had a chance to read those before we were here today. And so last time I think we had kind of started to address population. And I think we had said ages 0 to 26, and I think we had said all kids, and I think we had said we want to focus on behavioral health specifically. And I think that is where we left off. And so with that, I'm going to pause and look to Shale if she wants to jump in.
I think the hope is we've got a whole series of questions, and there's a ton that we could dig into with this. But we felt that at least with these questions as they're structured, it can begin conversation and we can see how far we go. And in particular, if there's some issues that seem to be really thorny, we can even set aside additional time for potentially small group work or other opportunities to really dig into some of the thorny stuff, right? But I do think that we started with this last time. It was actually a nice entry point for folks to be able to say, you know, there wasn't a whole lot, we got some discussion, but not a whole lot of dissent around the idea of 0 to 26, around the idea that we were trying to really be broad with all kids, including the understanding for universal needs and prevention to address behavioral health, and that we were talking about behavioral health, not limited to mental health, right? So I think I would still take that as a starting point, and let's keep going. And on this discussion, you know, we can really start to dig into a little bit more around what are the functions that you think are critical to the governing body. And, you know, I'm going to just pause and be quiet and let you guys think about it for a moment, and then we'll see what your thoughts and questions are.
Can't make that any bigger.
No, but there are some seats down here. So please
you can move forward.
Yeah, please feel free to move around it.
Functions, as we're defining functions, include prevention, that System entry, screening and assessment. I think we're going to get into that undoubtedly in more depth. We have planned to get into that undoubtedly in more depth in another couple of weeks. What is crisis response in terms of a function? Systems navigation, financing, transportation, benefit design. There's all kinds of components that are the functions that this governance body could oversee. Yes.
Or we just put the shout out.
Please jump in. We're just getting this rolling.
So I have a couple of thoughts. You know, first of all, I know we kind of glossed over the survey, or not glossed over, but we just said everyone in general agreed with this governance, and we can talk more about that down the road. But there are some big picture things that I think we need to digest before we functionally say what a governance structure should look like. First of all is what the relationship would be to the work of the other task force bodies. If we have the main task force over here looking at a governance structure for adult behavioral health or for all behavioral health, making sure that we're plugged into that so that we're not having 3 or 4 or 5, I can't remember how many task forces we have, all designing different governance structures. And then the other piece I talked to Shanna briefly about last time is making sure that while we're doing this, we're also saving time for a conversation about other important changes that we don't want this group to overlook while we're looking at governance structures. I don't know if that becomes a parking lot conversation or something else, but you know, looking at immediate things that we could ask a governor for: sufficient mental health professionals in schools and elsewhere, adequately funded preventative and early interventive care for all kids in Colorado, you know, essential benefits, all those things that could be part of a new governance structure 1, 2, 3 years down the road. But will we have a forum here in this task force to talk about that? And I'm sure you've already thought about that, but I just wanted to put them out.
Yeah, no, I think it's really important because I'm sure that a lot of people are having similar questions. When are we going to get to that? How are we going to get, you know, how are we going to pull that all in? And we have talked about it. We're trying to just balance what's the right starting place. Undoubtedly, we will need to come to some degree of some sense of agreement on a framework for what are the services that we're talking about. Essential, from prevention and promotion to early intervention to treatment to recovery and rehabilitation. What does that look like? We're talking about that across the task force and what that whole continuum of services looks like. How that is unique to kids is going to be really important because, quite frankly, you know, I don't know that it's going to be as high a priority in some of the other conversations to talk about school, right? And having enough providers in the schools, right? No, you know, it won't. And that's why we exist, right? That's why this subcommittee explicitly exists, so that we can understand where all of that will fit in that full continuum. We will absolutely introduce that sooner rather than later, in so much as it will help us all know that we want to fill all of that out. Because I think a lot of work has been done in other states and nationally and here in Colorado to define what that continuum looks like. So we'll put that forward, okay? So don't stress that we're going to get to that someday, but we're not going to highlight it, because the recommendations I think are critical. And recommendations around accountability and financing and quality and measures align with all of the different kinds of services across the continuum. And we've got a plan when we sort of hit this timeline that we showed you at the beginning. So this is what we may talk about through September, October, and then we are digging into sort of the greater whole. I think that's how we start to carve it out. That's a little bit of how we're envisioning it right now. Yeah, so I think that's really important, and it is important. And I'm going to actually look over my shoulder to see if you want to make any comments somewhere about how governance is being discussed, because I actually wasn't able to attend the overall task force meeting this morning. And so I don't know if you have any other comments that you want to make regarding that. I haven't gotten there yet. So that's an interesting element of how this group has in some ways a different platform to start from. And not because we are just taking hook, line, and sinker work that has already been done, but there has been a lot of Colorado stakeholder input to get us to a starting place that's a little bit different from where the Behavioral Health Task Force sees itself as starting. So that is how and why some of this discussion started with, you know, if governance is critical, and we know that governance has been identified as a critical component of a successful behavioral health system across the country, might that be a big, meaty piece that we know we can get into early on? That's how and why we started here. Yes.
Hopefully this isn't outside the scope, but
I can't hear myself. I'm passing the mic.
should I wait?
Yeah, because we can't hear you very well. And if I can't hear you here, I can't imagine someone on the phone can hear you. So
I never hear that I'm too quiet, so that's great. Okay, so as the resident lawyer here, one of my concerns is that